Hi, everybody. This is the Dr. Debunk Weekly Podcast Show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is part 3 of the antioxidant inflammation connection, the most important medical discovery of my lifetime. So, if you haven't listened to part 1 and part 2, you really need to, or you'll be lost. What I'm doing is really a podcast, a 3-part podcast on a book I wrote 5 years ago about inflammation and oxidation because of the amazing discoveries that started about 7 years ago, which is the ability for high-dose antioxidants, in this case resveratrol, to block chronic inflammation. Oxidation and inflammation are two separate subjects or two very different metabolic and cell molecular actions in the human body. Since chronic inflammation is the main driving force that robs us of our age and is really the driving force for degeneration or disease, controlling chronic inflammation is extremely valuable. So I left off last time with saying I was going to talk about the types of antioxidant or the brands of resveratrol to get, and more on the dosing amounts. But before I did that, I realized I didn't go into the side effects, concerns with use, toxicity stuff. I did mention that the main side effect of too much resveratrol is diarrhea. It's a laxative. And that really is honestly the worst thing. Now, you can be allergic to anything, and I've had a couple people that were allergic to grapes or wine, and they had problem with resveratrol. I mean, resveratrol was first described in grapes and wine. It's grapeseed extract. You probably heard of that. Well, what's in there is resveratrol. What's in all fruits and vegetables that's an antioxidant is generally resveratrol. The effect it has is from resveratrol. But it's in everything. I mean, most resveratrol is made now from these roots. I can't remember the name of the plant, but they have a ton of resveratrol, so they extract it, and it's the cheapest way to get it. As far as toxicity, to date, there is no way to take too much resveratrol. No toxic levels have been defined. And the reason for that is you just get diarrhea when you take too much. So it's all going out in the toilet. I mean, we have blood studies. We have a good idea of how much resveratrol gets in the blood based on how much you take. And so other than having an allergic reaction, if you don't have one, then the only problem you'll have is the limiting amount you can take based on when it causes a laxative effect. I won't talk about anatobine. I did a lot in the book about that. But I just do want to mention that for those of you that have some science, I basically was saying that in some ways resveratrol has an anti-inflammatory effect like a steroid. Now, it does, but only very specifically. Resveratrol, to date, only affects the binding in some capacity of the interleukins. It blocks the interleukin effect. It doesn't do anything else that steroids do. I mean, steroids suppress your entire immune system. Steroids suppress the way your bones regrow. I mean, that's why they cause osteoporosis. Steroids in excessive times, using them too much of your life, will give you dementia. It'll wreck your brain. And then steroids also suppress all endocrine functions. Your hormone systems, if you take enough, you won't make hormones. Resveratrol doesn't do any of that. So, and that's what makes it valuable. And then the other thing worth mentioning is, as this first got going, we had little concerns that, well, if you suppress your interleukin response, that's essential for infections. So you don't want to stop your body from recognizing you're having an infection. And it'd be potentially a reality that resveratrol could do that. But there's been studies done now that show that, nope, in fact, with age, we over-respond with inflammation to infections, And it would be better if we didn't over-respond. So actually people with infections get better faster if they're taking resveratrol. So you don't have to worry about that. And I think that's pretty well established. Okay, so that's the toxicity stuff. So to get into dosing or brands, as I mentioned before, tons of people make resveratrol. Everybody's making it. Because most people know all about its antioxidant effect. And because it's a relative thing, I mean, you can see over really hundreds of years that antioxidants had some type of anti-inflammatory effect at low doses. Probably the most famous is the spiced turmeric. What's in there is something called curcumin. Curcumin is an antioxidant, and it's been studied, but to date, there's not enough work to know how to dose it, or I don't think it's even made strong enough. I've had some patients try some high-dose extracts of it who couldn't take resveratrol, and I really didn't see the benefits. I think it'll come along. I think curcumin someday will be able to be used, and hopefully it won't have the laxative effect that resveratrol. But from what I've seen, there are no other antioxidants, natural nutrient antioxidants, that have enough science to warrant use, because that's the only thing I can recommend. If there's no science, I really can't comment on it. Anyway, so resveratrol. How do you know what brand to get? Well, the first thing is all the higher quality stuff costs the same amount. You can't make it any cheaper than what it costs to make it, to extract it. Resveratrol is called a polyphenol. Polyphenols are these specific molecules we find in nature. You can look up what they are. Resveratrol is one of them. There's numerous ones. And so when you make resveratrol, first you extract the polyphenols, and then you purify it down to resveratrol. Well, that costs money. And so there's a lot of junky products out there that are mixed polyphenols. If you pick up a bottle and it says mixed polyphenols, just throw it back on the shelf. You need pure resveratrol. And so it can't be like a 50% extract. Like you can go on Amazon and they got these 500 milligram resveratrols. It's really 250s, but it's like a 25% extract, which means it's really 1/4 of that. It's not 500 milligrams. It's 125 milligrams per dose. And so that's why the price is cheaper. And then you see resveratrol that's got some pure res, but then it's got some mixed polyphenols. And that brings me to the brand that I've used. Now, I don't care what you use or get. There's a company in California that makes a full line of vitamins called Source Naturals. I like them. I don't have any ownership or stock in this company. I don't care. But I think they make good products. I won't get into why. And they make resveratrol, but it's at the higher end of price. And then you have this company called True Nature. And I did all my studies on True Nature. The brand name's called True Nature. And I think the company's owned by Costco now. I can't say for sure. But Costco's big on selling it. But they sell two types of True Nature resveratrol. They sell the pure stuff, 250 milligrams, and then they sell this junky stuff that's mixed polyphenols. But it's 300 milligrams. So you might think, oh, 300 milligrams is better. But it's not better because if you look carefully, there's only 75 milligrams of resveratrol. The other 225 milligrams are mixed polyphenols, which we have no studies on to know how effective they work. And I can tell you, after having many patients, 50 to 100, who kept confusing it and getting the junky stuff, they would come into my office crying, saying, "Doc, this stuff isn't working anymore. What's wrong?" And it's like, you got the wrong one. If you get junk, you'll get a junky result. Don't hop in some junky little economy car and expect it to go like a Ferrari. And so I still tell patients to get the True Nature. The price is the best at Costco, and I think that's just because of the discount, the volume they do. And I can tell you it's not I don't believe it's 92% pure. I probably will get in trouble someday for saying this, but all products are supposed to be 92% pure. That means if it's 100 milligrams, it's supposed to be at least 92 milligrams or more. But nobody checks unless it's USP verified or one of the other verifying companies. And True Nature's not verified. And I talked to Costco about this and to True Nature, and they wouldn't tell me, how pure it really was. They wouldn't tell me their processes, which is a red flag to me. And from having people use the higher end stuff that is pure, I think it's probably 80%, whatever. I'm just guessing. I don't know. But I know it works. At the dosages I've told you, it works. And if they start cheating, if they start making it 20% or 30%, 25% extract, 50% extract, it's not going to work. And people are going to feel it. Just like they did when they got the junky True Nature, that 300 milligram mixed polyphenol. I have so many patients that come in and they thought, oh, it's all the same, doc. I don't know. I saw it on Costco online and I thought it was the right one. And so you get the 250 True Nature. The highest dose resveratrol that I've seen is 250 milligram capsules. They make all different strengths, 50s, 100s. Anyway, but to date, some people have told me they can get the same brand True Nature on Amazon or some other place. I don't really care. So far I haven't found anybody that's, I haven't looked in a while, but I haven't, in the past, I looked and nobody had a resveratrol that was USP verified. I mean, the best nutrient you get is verified by an outside testing lab like Consolidated or USP or Underwriters Lab, UL. There's another one, NSF or something. There's 4, I think, main testing companies that'll check a product. So if you have a little outside testing symbol, that's the best. Anyway, so that's kind of it. You don't want to get the really cheap stuff because it's cheap. And so far now, I've had nothing but good results with True Nature. And again, I don't own any stock in True Nature. I don't have any financial anything. I could care less. And so that's pretty much it. USP verified if you can find it. And that's how you do the dosing. So what I'm going to do, because this third one really isn't that long. What have I missed? Oh, duh. Young people, athletes. That's what I was going to get into today. Okay. So I talked to you about how to use it in the last podcast, which is really relevant to people over 45, 50 that are getting into the chronic inflammatory phase. But what about athletes? What about young people? What about 25-year-olds that are addicted to running and they want to run 4 or 5 marathons a year or something ridiculous, or maybe 10Ks? Well, when you do extreme physical activity, you are causing massive inflammatory responses, many times than what should be. And so you can use resveratrol to calm that down. And so marathoners, I tell them, look, a week before the race, load up on resveratrol, take 4 to 6 a day. Split it up twice a day. And then the day of the race, or after the race, you would keep taking it probably for a week. Athletes tell me different things. Some people do it 3 days beforehand and 3 to 7 days after. But you will recover much quicker. So any extreme physical event, or either body event, you can use short-term resveratrol. Now, it's not something that people under 40 should take all the time, because studies have been done. Younger people don't have chronic inflammation. And so to take an anti-inflammatory, even a natural one, we don't know what that would do. And so it's just not a good idea. And while I'm here, if you look at the studies, like I said, there's 15 clinical trials. You'll see a couple of them that show it doesn't work. The clinical trial says, we tested resveratrol for its anti-inflammatory effect, measured interleukins and CRP and blah, 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 and it had no measurable effect. But here's the kicker. If you look at the population of the studies, they were checking young people. The studies, the two I saw that showed it failed, the other ones show that it works, were done on 25-year-olds. Well, 25-year-olds don't have chronic inflammation. So of course you're not going to get an effect. It's like, who would do a study like that? It doesn't make any sense. I don't know. Again, conspiracy theory. Were they trying to show evidence that it doesn't work? Maybe, but that's another topic. And so the studies that were done on people that were over 45 in general, and they dosed it twice a day, got great results. That's the other thing. You see some studies where they give it once a day. Well, it's not going to work because you never get a high enough blood level to cause an anti-inflammatory effect. You're just causing an antioxidant effect. And so, of course, your CRP and homocysteine don't go down and people don't get the changes in their body. But anyways, so for young people, 25 to 45 years old, you can use it to recover quicker. It probably can affect your ability to perform. And this is where it's a shame about Anatobine, as I'd mentioned. The other antioxidant was the company targeted older professional athletes who would rave about this stuff. And I'm an older not professional athlete, and like I said, I will never stop taking it. So that's pretty much it. I just want to do a summary, I think, to lay it out, the key points. Okay, point number 1, chronic uncontrolled inflammation in the human body is probably the most potent factor that causes us to age in an accelerated fashion. And it is probably the most important factor that pushes us towards disease. Whatever disease, based on your lifestyle, you're being predisposed to. No other modulator of our health, I think, has more damaging effects than chronic, uncontrolled internal inflammation because it is the precursor to degeneration, and degeneration is another word for disease. The laboratory and clinical evidence of the last 7-8 years unquestionably shows that high-dose antioxidants will directly block the body's ability to upcycle chronic inflammatory stimulators like the interleukins 1 and 6, CRP, homocysteine. Enough research has been done on resveratrol to safely use these antioxidants for long periods of time, under the guidelines of my book, with no long-term side effects. Now, part of this is based on the 30-year history of using other natural nutrients at high doses without any natural effects. I can say that basically because we have done high-dose therapies with other nutrients. At this point, your signs and symptoms as subjective markers of chronic inflammation, along with the objective markers, blood inflammatory markers, creates an objective and reproducible natural treatment program, which is just a fancy way of saying how you feel about your body's health. Feeling inflamed and painful will correlate with the blood work, which helps us know how much of these antioxidants to give you in the long term. There's still a lot to learn about the use of high-dose antioxidants, but because it's natural, they are natural, the safety profile is far better than drug therapies. Therefore, we can use them now even though no large multi-center trials have been done. Like I said, there's 15 small clinical trials. In my opinion, it's much safer than the chronic drug therapies for inflammation. Now, there's some exceptions to that because they have new inflammatory modulators that are really playing off the body. I won't explain that. But in general, you can't take drugs for life without having a downside. And I talk about the use of chronic medications, and 20 to 40 years later, you'll regret it. whereas people take high-dose vitamins, nutrients, numerous natural things for life, and they're better off for it. The cost of antioxidants come down so much that the current therapy that I've recommended to you, resveratrol, is about $25 a month. And then when you get into long-term therapy, it's $7 to $10 a month maybe. What's fascinating is because it's the use of it has grown, that if you did this therapy 6-7 years ago, it would be $100 a month. Most people in their 40s begin to feel the effects of chronic inflammation. And this is generally the age the body is transitioning from an over-oxidized state to the chronic inflammatory state. So that's the age to begin high-dose antioxidant treatment. Your signs and symptoms, along with blood testing, determine the need for this. However, they can be used in younger patients for short periods of time, as I just mentioned, to naturally treat the excessive inflammation of extreme body stress. Or if young people, if you seem to have chronic inflammation and you can confirm it by blood tests, you can absolutely use it. I forgot to mention that, but if you're 25, and I have some young people that have sky-high inflammatory markers, I put them on high-dose resveratrol, and they improve. Athletes can use higher-dose antioxidants in times of extreme physical exercise, as I mentioned. We're learning more about that every day. But again, since it's going to be short-term, 2 weeks or so, it really doesn't matter that we don't have long-term stuff yet. Now, if you're going to, as a young person, use it more chronically because it helps you, you need to get CRPs and homocysteines, because we don't know what it means if your CRP and homocysteines are normal, but you have aches and pains, and you want to use resveratrol to fix it. There's no science there, and I can't recommend that, because now that gets too close to like medical treatment. So that's about it, except for I have to do a disclaimer because of this fact. Everything I'm telling you sounds very much like a medical treatment protocol, but it's not. It's a natural treatment protocol. Nothing that I recommend in this book can be construed to be medical diagnosis or treatment. The information in the book is a result of the decades of my clinical practice experience and clinical study. The information in this that I've given you on this podcast is general in nature and not a substitute for an evaluation or treatment by a competent medical doctor. See, by medical definition, naturally lowering your chronic inflammation is not medical treatment. It's not medical treatment. Traditional medicine defines chronic internal inflammation as a result of diseases, of the process of disease formation. The natural protocols I outline in this podcast and my book reduce inflammation naturally. They don't treat any disease or medical condition you have, even if these diseases or conditions are contributing to your body's level of chronic inflammation. Let me explain that. Okay, using a natural substance that happens to lower your inflammation has nothing to do with a disease that may be causing inflammation. The disease can contribute to inflammation. I'm not doing anything. Resveratrol doesn't do anything to your disease. So when I use the words treatment, dosing, or other common words that are associated with the practice of medicine, I don't mean them in the medical sense. I always mean natural treatment or dosing of natural substances. So, if you think that your inflammation is due to any kind of medical problem or diagnosable medical condition, you have to see a medical practitioner, and as soon as possible. And I alluded to that with, say, a young person that has symptoms of chronic inflammation, pain, joints, internal body parts, and yet their CRP and homocysteine are normal, that would imply you have a medical condition and you need to see a medical provider. And that would also hold true for people over 45. So that's pretty much it. I'm Dr. Debunk, and I have just done an educational Professor Debunk for you on understanding inflammation, oxidation, and the most important discovery, I think, natural discovery of my medical lifetime.